Focus once more on the conditions exposed at the Rahima Moosa Mother and Child Hospital in Johannesburg. That health ombud report today finding the hospital was unhygienic, overcrowded, impacting the care and dignity of patients. One of the people who raised the alarm on the state of the hospital was paediatrician Dr. Tim de Maayer. He wrote an open letter detailing an under-equipped, badly run hospital that was risking lives. The whistleblower, though, had to fend off attempts to discipline him by the hospital. He was supported by a massive group of healthcare workers who united under the banner I Am. Let's speak to Professor Adam Mahomed, who was part of that movement. He's also head of internal medicine at Charlotte Maxeke Hospital here in Johannesburg. Prof, thank you so much for joining us. Your response to the report, do you see this as complete vindication for Tim de Maayer and other whistleblowers?
Good evening, and thank you for having me on your show. It's actually a strike for advocacy, a strike for honesty and transparency, and a salute to Dr. Tim de Maayer and those that supported him to stand up for what was right. The brushing aside, the intimidation from Gauteng Department of Health to these doctors and healthcare workers has now been quietened, and I hope officially this will not be the end of doctors standing up, and it highlights how honest and accurate he painted the picture and the sad state of affairs at Rahima Moosa, which is a reflection of the entire southern Gauteng region.
Yeah, I mean, this is the thing. First of all, it's by no means a recent development at Rahima Moosa, and there are problems at many hospitals, particularly in this province. I want to focus, though, on this hospital, perhaps as a good example, because when I interviewed the health ombud, if you read through his recommendations, one of them is the 2017 report that looked into this very same hospital. Could those recommendations actually be implemented? So we're sitting with a 6-year-old report that was never implemented. What do you think needs to happen now to give real meaning to these reports, to create action?
I think people must be held accountable. Too many times we have meetings, we have reports, we have disciplinary issues, we have suspensions, we have resignations. But the core essence of patient care, healthcare workers, nurses, general assistants always remain the same and continue with their hands tied and their eyes closed to deliver service. There is not a single person who has been held accountable or responsible for the shenanigans that has happened at Rahima Moosa, and it's still ongoing. Don't think that this report has made any change. I can assure you, the report still stands as fresh as today from what happened 6 months ago. And there's no improvement. They're still under problems. They're understaffing. There's still dirt. The boreholes were put up by gift of the givers in a big urban metropolitan center. Good public-private partnership. But whose responsibility it is? And that report is shocking. It highlights every level of that hospital being dysfunctional, of administration. And nothing has happened to date except a transfer to a higher position in provincial government as a reward for being dysfunctional.
So I asked the health ombud about that because I didn't understand it. Reading between the lines of what he said is that this is someone who was completely out of her depth as CEO, that the appointment process, they just chose the wrong person, because being a good doctor doesn't make you a good manager necessarily. And he sort of alluded to that she has health problems that she needs support with, and she has therefore been transferred. And making perhaps a good point that she's not the beginning and the end of the problem, is she?
She's not the beginning and the end, but it reflects the beginning and the end of HR and double standards. A doctor and nurse would never get appointed through the processes that the CEO got appointed. A doctor, a nurse, or a general assistant or a clerk would be fired, would be disciplined, and things would happen.
Okay, so we're going to try and get that line back. That's Professor Adam Mahomed. He did say that he's in the middle of load shedding and this might happen. We're going to see if we can get him back on the line. But what he's pointing to really is a systemic problem. Making the point that while Rahima Moosa is in the spotlight, there are conditions, particularly in southern Gauteng areas, hospitals in those areas, that are particularly dire, that desperately need attention. Speaking there about the CEO, who was, it seems, just absent from her post for a very long time. When I spoke to the health ombud earlier, he explained to me that she has been transferred. She's now sitting with the provincial health department, alluding to some sort of health issues. We're not too sure what. There may be extenuating circumstances there. The reality is the people who appointed her need to also account and explain themselves. There's a systemic management issue. It doesn't just relate to what's happened with the CEO. Professor Mohammed, I believe we've managed to get you back, despite what load shedding is trying to do to this interview. We were talking about the CEO, and you're saying that, you know, reiterating really what you were saying earlier about accountability. How much worse are conditions at Rahima Moosa compared to other hospitals in Gauteng? Is it markedly worse? I mean, there are some dire situations generally, but is Rahima Moosa the worst of them all?
I think, to be honest, it's hard to compare apples and oranges when the crate is rotten. And challenges like this occur at Helen Joseph, Baragwanath Hospital, Charlotte Maxeke, Edenvale, Bertha. It's that management and doctors are scared to speak out. But I can assure you, simple thing as hot water is lacking in a lot of hospitals. Good quality food is lacking in hospitals. Ability to get medication that's appropriate for patients is lacking in hospitals. But red tape, we have a lot of that in the Gauteng Department of Health and in the hospitals. You can't get more red tape than in the Gauteng Department of Hospitals. And that's the challenge. Let us do what we need to do and focus on healthcare, and let the red tape be dealt with someone else. And Rahima Moosa is in shambles. It's serving such a huge population, and the doctors working there have highlighted this. I mean, you highlighted the 2017 report, which was done by doctors, and it was aimed to get better patient care. And nobody did anything. Yet, who's going to be held accountable? Mental health care services in Gauteng, it's still shocking, even after life Isidimeni. But yet, no one speaks out. Department of Health, Gauteng Department of Health, all we do is we play musical chairs on a sinking ship. How many MECs, how many HODs have we had? Yet, patients are suffering, and the most vulnerable are suffering.
Absolutely. And certainly Professor Malakapuru Makhoba says that he has been in direct talks with the Premier, Panyaza Lesufi, and he says he believes that the Premier is really committed to making a difference. But I think equally important, and Tim de Maayer has hammered this point home really, that individuals have to keep on speaking out. I want to ask you about Tim de Maayer. Is he still at Rahima Moosa? Is he able to carry on his work? How's he doing?
He's still at the hospital. I think I'm his friend, and he's a really amazing human being. And he's an amazing doctor as well. And he would do more, but somehow I think we've broken a small percentage of his enthusiasm, and back with the abuse of the CEO and this Gauteng Department of Health that didn't come and to the rescue and say what is right. Sorry, CEO, you're wrong. You can't do this to our healthcare workers. It's only when people stood up together that he was protected. And I do think he's an amazing asset for this country. And remember something, he's a pediatric gastroenterologist. And that's like a rare diamond in South Africa. There's less than 10 in the country. His heart and passion is to serve patients. He takes out money from his pocket. So you can't find better. I just wish we find better managers in Gauteng.
I have to, in closing, ask you about the hospital where you work at Charlotte Maxeke. We saw violent strikes by Nahawu last week. We know that Charlotte has been just suffering through so much. I mean, never mind the systemic problems, but also the fire that took so long to recover from. Please give me your perspective on the Nahawu strike, what it ultimately achieved, and how the hospital's coping at the moment.
I think it did affect patient care. It affected the numbers of surgeries. It affected what we needed to do. However, I would like to say I do understand from where Nahawu is coming. Those Those workers at the lower financial income spectrum are an immense strain, financial burden. The cost of living is going up, and they see the discrepancy between Gauteng, between themselves. You say there's no money, yet the ministers are being appointed, getting so many more perks, so many more deputy ministers. You see so much corruption being happening, and yet you can't give us money. So they hurt, but I'm not agreeing at all with the technique and mannerisms in what was happened. But I think there are two parties that are putting patients' lives at stake here. It's the government and Nahawu that should be at the table, and they're playing with people's lives. Both parties are guilty of compromising patient care, and this is just not Nahawu. The government has to take responsibility and go to the negotiating table, and let's be honest and help people out and be kind to each other and talk to each other so that we can help people and patients in this country.
Thank you so much for speaking to us this evening. It's always such a pleasure. Professor Adam Mahomed, Head of Internal Medicine at Charlotte Maxeke Hospital in Johannesburg, just commenting in that last question about what's going on with the Nahawu strike. Some signs suggested by the interview with the South African policing unit that there may be attempts to get everyone back to the negotiating table. Well,